Welcome to the Mind Body Temple podcast, your healing space with Dr. Rod. The purpose of this podcast is to bring back hope to patients that are suffering from chronic conditions like pain, anxiety, and depression. My guest today is Larissa McKetton, who is a neuroscientist. She has been very kind to give some time for us to have discussions about the concept of mind-body medicine that we use in Mind Body Temple discussions. Thank you, Larissa. Can you introduce yourself a little bit and what you do and your position and your work?
Yeah, thank you so much for having me here. Dr. Kevin Rod, my name again is Dr. Larissa McKetton. I'm a neuroscientist. I work as a scientific associate with the Rotman Research Institute and the Director of Clinical and Scientific Development with Baycrest Health Sciences. And I have such a passion for anything related to brain health, neuroscience, and disseminating this knowledge to everyone, from caregivers to anyone really, about all the ways one can improve their brain health and reduce risks of developing dementia, for example. So it's important. So thank you for having me here.
Thank you so much for coming. In our work, we give a lot of importance into the brain health because it's through our brain that we perceive the whole world. But brain works with the rest of the body. And I always believe in this concept that we synthetically have divided humans' function or experience into different classifications, but in reality it's just one life form with different sections all working together in harmony. When we talk about chronic pain with our patients, it's important for us to bring up the basic level of health in order to be in a better position to fight with chronic pain or any other chronic conditions. And through this fight with these conditions, we want to reach a point of healing. And it's important that we work on different pillars of health. And when we talk about different pillars of health, activities, what we eat, the proper diet, nutrition, our mindset, our connection with others, our sleep, and how to stay away from things that are bad for our health, like the toxins. All of these things come to play. And I wanted to hear a little bit more from you as a neuroscientist and brain scientist with expertise in brain health to see how can we use the brain science and neuroscience to the service of our patients' healing.
That's a really great question. So there are actually different domains that, to help improve your overall health, your brain health, as well as improve your risk of not developing dementia. And these domains are in the realm of exercise, eating well, so having proper nutrition, managing chronic conditions like high blood pressure, high cholesterol levels, mitigating the effects of vision loss and hearing, so having your vision corrected and your hearing loss checked if you have hearing loss, so getting hearing aids as one example, making sure you are not socially isolated, so you are active and have ways to interact with others and not being socially isolated. So there are these different domains. And there was a recent paper that was just published in The Lancet in end of July of 2024, so just recently, that identified 2 additional risk factors to decrease one's risk of developing dementia. So back in 2020, there were 12 identified. Now there were an additional 2, which included vision loss and managing LDL cholesterol levels, so low density lipoprotein cholesterol levels. So in addition to those 2, other risk factors, as mentioned, included managing hearing loss, making sure you're not socially isolated, eating well, not eating foods that are ultra processed, for example, getting proper exercise. Education was also a component of it. And so all these things together actually in this paper could decrease your risk of developing dementia for up to 45%. And these are modifiable things one can do right now. So when you talk about all these domains, there's so many that one can do to influence their whole body wellness as well as their mind.
So not following these instructions, what will it do to our brain? Like, will it induce inflammation? Will it affect the immunity of the brain? How does it destroy the basic level of health that would put us in a disadvantaged position when it comes to healing?
So there are multiple ways. So if we just take exercise, for example, so if we want to go on to that topic, exercise actually promotes new brain cells to develop, or it enhances a term we call neurogenesis. And it does so by the form of neuroplasticity. So neuroplasticity is an important feature of the nervous system. It helps create new connections and create new brain cells to form in response to an experience. So exercise, as an example, can induce these structural and functional changes. And one way it can do this is with a protein called BDNF, which stands for brain-derived neurotrophic factor. And this protein increases in its activity and is directly responsible for helping with things like memory improvement, cognitive functioning. It helps with reducing feelings of depression and anxiety. And there are many other forms that it can take, but exercise also improves with decreasing inflammatory markers. So there's all these different things that can happen within the body, within the brain, based on specific things one can do. And if we're talking about exercise, that's just one example.
Yeah, exercise. Let's talk about we said that there are different pillars of health, and exercise is one of them. So if you can have like what you eat, nutrition is another pillar, and how your mindset is, positive thinking, and staying away from negativity, another pillar, or having good sleep, or staying away from toxins. These are different pillars of health. So let's have a little bit of discussion about exercise, because in chronic pain it's important for us. When we have patients with pain, when you have pain, your brain tells you not to move to avoid further pain, because your brain wants to keep you from difficulty, or wants to protect you. And once you start not being active, when you stop moving, you will start to lose muscles. And when you stop muscles, your pain becomes worse, because the pressure will go to your ligaments, and ligaments are pulled, they get more pain, and stiffness sets in. And aside from all other difficulties that you may develop, your pain becomes worse. And you get into this vicious cycle of less activity, more pain, less activity. And we always talk to our patients that mobility and exercise, range of motion exercise, and specifically muscle strengthening is very important. But I would love to hear it from a neuroscientist and brain scientist on explaining why are these important for our health, and how it can help to prevent further decline in our health or improve healing.
Yeah, related to chronic pain, as you mentioned, with exercise, it promotes blood flow to the body, blood flow to the brain. And one thing it does is by doing so, as blood flow is increasing, it actually improves the stiffness of the arteries to promote blood flow. So that's another way it helps to manage chronic pain, is just by promoting this blood flow. So there's that one aspect of it. And when I mentioned about like the neuroplasticity piece, there were prior human studies that looked at exercise and the effects on the brain. So I talked about certain proteins like BDNF that are increased, but also there are structural changes and volume increases in like white matter and gray matter structures in the brain, as well as with a structure called the hippocampus. The hippocampus, as you know, is, for those listeners who don't know, it's actually derived from the Greek word hippo, meaning horse, and campus meaning sea monster, but it's like a seahorse structure in the brain, right. And it's related in memory formation. And so studies have shown that exercise, specifically aerobic exercise. So aerobic exercise is where your heart rate is increased. It's not necessarily like toning or stretching, but it's things like running or really getting your heart rate up. So those types of exercises were found to increase the volume of the hippocampus. Now, the hippocampus is a structure that's related to memory, attention, and learning. So we can see that exercise has direct impacts on learning new things, on your memory, And so there are a lot of benefits with exercising.
So it's not just the muscle that will increase in size, it's the brain actually. You can
Yeah, there's
improve the
structural
size of the structure.
changes, and it helps with function, and it helps with learning new things. And so there were prior studies that actually showed that students who had higher fitness scores actually had higher scores on tests. So it's important to think about, if you want to learn new things, exercise is one thing that you can do for your brain and for your memory. And the hippocampus is a structure that actually decreases in size and volume with dementia and Alzheimer's disease. So exercise is one of the modifiable risk factors one can do to decrease the risk of developing dementia. So if you really want to think of in terms of improving memory, that's one thing you can do.
Can you spend a little bit of time to explain more about the neuroplasticity? This is a word that's being more and more used these days, and a lot of people fall in love with this name, and because it's a word that gives people hope that your brain can reshape and can improve. I remember when I was a medical student in the beginning, it was a long time ago, it was early 80s, they told us that once your nervous system is shaped, nothing is going to change, and if one part is damaged, then it won't repair. But from that time till now, it's amazing, over the past, say, 40 years, 4 decades, there have been so much improvement, and there's actually this hope that you can actually have new connections in brain and you can improve your nervous system.
You bring up a really great point. So yes, medical textbooks and other students back in the day were told that all the brain cells that you were born with, that's it. You know, it's static, it's not changing, but we know that's not true. Neuroplasticity is the way the brain can reorganize itself, form new connections, have new brain cells grow, so neurogenesis, which is the formation of new neurons in the brain in response to things like new experiences or new stimuli. And even after a trauma to the brain, your brain can still reorganize itself. So your brain is plastic in that sense. So the term neuroplasticity, again, refers to the brain being able to modify itself, create new neurons, or create new connections in response to a new experience or stimulus. And that's really important to think about. There are some structures in the brain that actually have new neural brain stem cells form, like the olfactory bulb, right? And so you might have thought of, when you smell new things, why does that trigger, such a great memory response? Well, there's actually neural stem cell turnover, and so there are some structures in the brain where new brain cells are developed. So it's a remarkable feature of the brain to create new connections. And so when you do something new, so for example, say you're right-handed and you always brush your teeth with your right hand. If you start to brush your teeth with your left hand, that's going to sprout new connections, right? When you travel and you go somewhere new and you're trying to organize yourself and figure out where you are in space and in that location, that's going to form new connections in the brain. And so
you're actually making new connections,
yes,
and you
constantly doing new things.
And it's something we can do to improve those connections, to use the non-dominant hand.
Yes, absolutely. Research has looked at learning new things, like learning a new language and maintaining it. Yeah. So it's not just when you are bilingual as a child and forget that language later on, but it's maintaining and continuing speaking in other languages. That's one. Playing a new instrument or learning how to use a new instrument, and just constantly doing new things. And so there are rates of cognitive decline that happen when someone retires. So it's very important when you're even talking with your patients or others that people have passion or a plan in place when they retire, because for a lot of people their career was their purpose, right? And we were talking about purpose before. So when someone retires, it's important to find what those things are so they can maintain their brain health. They can still continue to make those new connections, and so that's also an important piece to keep in mind.
It's a very important fundamental discussion that I have with my patients, that a starting point of our work, or my method of treatment, is with finding the purpose, getting clarity about the purpose. That basically becomes the reason why they want to get better, aside from just bringing the pain down. Because pain is a symptom that can go up and down, but it's the origin of the reasons, the main purpose of life that is very important. That will give us energy to move forward. And on the other side of the spectrum, once you get closer and basically make your purpose happen. Then instead of happiness, we focus on fulfillment, because happiness is a transient state of mood, but fulfillment is a more fundamental state of satisfaction when you get closer to your purpose or get closer to your true self. These are essential, fundamental concepts that we discussed that will bring more meaning, like a higher meaning to the process of treatments that will induce more healing and improve the path, the journey for healing and improvements. Aside from the effect on having new connections and having new nerve cells, how can all of these help people to learn things more when they are in adulthood compared to the childhood? Because I hear that as a child, like if you're 2 or 3 years old, 4 years old, you don't even need to concentrate. You pass by somewhere, you hear music, you can just record that music. But at our age, I think there are two components, and I want to hear more from you about these two. Because learning, when I'm teaching all of these self-care concepts to my patients, the whole mind-body-temple concept, we are trying to change the behavior. Mm-hmm. So by learning, the purpose of learning is to change the behavior and make change in our the way we have our lifestyle, for example. So we need two components. One is the full attention mm-hmm. as an adult. The second is to repeat those practices. Repeat enough, like they say, the neurons that fire with each other.
They're wired together. No, there's truth to
that. That's repetition. So concentration and repetition are the two components that we need in order to make use of the neuroplasticity mm-hmm. as an adult. Am I right?
Yes, and I would add to that is your mindset. So if you enjoy it, if you have, even if you, that expression, just smile and the whole world will smile with you. Even if you're feeling low, it's this ability to enjoy what you're doing, because that's going to enhance
the attention, I guess.
Yeah, the attention. There were studies done, and I know we talked about exercise, but I'll give you an exercise example and maybe a music one, where researchers looked at grip strength and other studies with exercise, and the people that visualized how they would look and imagining their arms getting stronger, so visualization is also an important variable to keep in mind, they actually had higher outcomes and improved grip strengths and a muscle formation compared to the group that just exercised alone. So visualization is also important and a key metric and something that one can do to improve their outcome of what they want to accomplish. They've done studies, for example, looking at piano players where there were several different conditions. One where the group was taught how to play a piece and they would practice daily. And then the second group where they were taught the first day but had to imagine what they were playing, and they had the same brain regions activate after, say, 1 week after that experiment. So visualization is also a key component that could enhance and improve mm-hmm. the outcomes that some people want to accomplish, right? So
it's amazing that if we do exercise, that we can have new nerve connections that would help us as a tool to use for better concentration. And when we repeat things, even learning to do exercise modalities, different forms of exercise, by repeating those exercises, we're actually creating new connections that we can then use those connections to have better practices and record the practices for the lifestyle enhancement that we want in mind-body medicine.
Yeah. I agree. And to even talk about exercise more, it also helps improve mood, as well as decrease your levels of anxiety and depression. And this has been statistically measured both in patient populations and as well as in people without any clinical conditions. So it's or severe clinical conditions. It actually has direct improvements in mood. And how it does this is when you exercise, your body does release endorphins. So that's one way.
What's the effect of endorphin for?
So endorphins also help with things like muscle pain relief. specifically beta endorphins. They are known for their strong analgesic effects. But some literature talked about how beta endorphins don't really penetrate the blood-brain barrier, so they might not be the main components to help this effect in the brain. It might be more with these endocannabinoids. So they do pass through the blood-brain barrier, so they might be more responsible for this feeling of improvements with reducing anxiety, this sense of calmness. So there are certain things that the body produces. Dopamine levels increase, serotonin, norepinephrine when you exercise. So all these positive effects on the body are related to exercise that one can do. And then also related to chronic pain, we talked a little bit about inflammation, how it also helps to reduce inflammation. And that is done by increasing anti-inflammatory cytokines that also help with aiding in tissue repairment.
Cytokines are the chemicals that are released by the white blood cells and immune cells, right?
Yeah, and it's important as part of the immune function and as part of the your body's way of healing. So that's another important factor. Other benefits of exercise also include sleep. So we all talk about if you are anxious or if you are depressed or if you have ruminating thoughts at night, it might make it harder to fall asleep, and you might have insomnia. So exercise helps lessen that internal chatter, and it helps promote sleep. And then what's important is you get a better quality of sleep, like REM and slow wave sleep. So it helps with the quality as well as the onset of sleep, as opposed to just staying awake for a longer time. So there's so many benefits just from exercise alone that can really help improve the whole body. And sleep is just one other component involved.
And I hear that there are a lot of new research that are coming about muscle strengthening and effective muscle strengthening. There are so many studies that are coming lately. One of them, another one from Lancet, said the best way to prevent recurrence of lower back pain is walking.
Yes.
So walking can prevent recurrence of lower back pain. Is such an important problem in our healthcare system.
Yeah, there were some studies that just looked at brisk walking and how even brisk walking can help improve your cognition and with cognitive decline. Just brisk walking 5 minutes a day. And so another common question is, well, how much should I be exercising? How often should I be exercising? What's optimal? And one answer, and I guess my answer is, any exercise is better than no exercise at all. And if you're sedentary your whole life, just even walking 5 minutes a day, already you're going to have improvements, and based on research. And so the Mayo Clinic had put out some recommendations on what one can do, and they recommend 150 minutes a week of moderate exercise. So this could just be biking or swimming or brisk walking. So you can break that up into 20 to 30 minutes a day. Or 75 minutes of vigorous exercise a week. So that could be more like running or swimming laps or like heavy yard work. So that's also important, as well as strength training. So we know as we age, bone density decreases and osteoporosis might kick in. So strength training, weightlifting, these types of exercises several times a week for 15 to 20 minutes is also really helpful. As part of the recommendations. But again, any exercise is better than no exercise at all. So I always encourage, when you tell your patients, to do some sort of mobility. And there's so many exercises online, even depending on people's mobility issues. So some people who might be wheelchair bound or cannot, don't have that much mobility, there's so many different types of modified exercises one can do. So it's important just to keep moving and be active.
Yeah, at the beginning of these discussions with some of the patients, because many of the chronic pain patients have also extreme fatigue. Mm-hmm. So it's not even imaginable for them to do exercises. And it's amazing how when they get started, and I always tell them to, set achievable goals, small goals, and each day try to be a little bit better than yesterday. Don't compare yourself to anybody else.
Yes.
And don't compare yourself to 20 years ago when you were younger. Just try to be a little bit better each day. Incremental changes lead into significant changes over time. But as they do this, 5 minutes a day, then it becomes 6 minutes a day, then it becomes 10 minutes a day, gradually their energy level also improves. Like, that's the magic of life, that you feel tired, and you feel more tired if you don't be mobile. When you have more mobility, you have more energy. As you burn more energy, you feel more energetic. And that's the uh, very beautiful paradox in life, that with more exercises, vigorous exercises, you will feel more energetic over time.
Absolutely. It seems counterintuitive that if you, oh, I'm fatigued right now, but
Yeah.
exercise directly helps improve with your fatigue, right? And you can feel it just immediately right after. You have more energy, your cognition feels better, your memory feels better, you just feel overall improvements in your whole body. So again, yeah, that's another key point to mention, that exercise directly improves with fatigue,
Yeah.
even though you are fatigued when you might be starting your exercise.
That's right. And it's a kind of important point, that us as doctors don't become fanatic about it, because it's true that if you have limited amount of energy, you have to somehow be very mindful about how you use that energy. So I'm also mindful not to push my patients too much to the point of exhaustion, because if they are fatigued and they run out of the amount of, like, the battery of energy that they have, then the depression will set in. So the game is to be somewhere in between, that they be able to use the energy that they have in a way that they'll build more energy, but not to exhaust them.
Yeah, and you want to sort of have that fine line where you don't want to discourage them,
Yeah.
or when they compare themselves to other people, it has to be sort of for themselves and what works for them, right?
Yeah.
What works for others might not work for them. So just making it tailored and
For my patients with fibromyalgia and chronic fatigue syndrome, it's very easy for them to get into this mindset. They actually come to me already with this mindset that nobody understands them. So it's important that they don't really feel like that. It's easier for me because I'm a chronic pain patient myself, so I know which word they're coming from. But it's very easy for professionals to, become fanatic about all of these guidelines and try to enforce them or push on the patient to do this or do that. But incremental change always will lead into better results than just pushing the patients to run out of the limited amount of energy that they have, in my opinion.
100%. And one way you can do this is even through incorporating micro habits. So you're not making some daunting task, saying add in 30 seconds. If you're watching TV, just do a couple of jumping jacks. Or if you like gardening, do a couple more squats, like as you're picking those vegetables up, or whatever it might be. So just even incorporating exercise into your daily routine that you would do otherwise, even if it's just a couple minutes a day, and you incrementally build it up. What's important about doing it this way is it forms a new habit, and habits take time, and you want to make it enjoyable, right? So that's another key point. You don't have to make them run on a treadmill for an hour. Like that might not be feasible for someone who's been sedentary their whole life. So personalizing these interventions for each of the patients, I think that's a great approach. And also to have, and when we were just talking about exercise, but also to have like an accountability buddy. That's another great way to keep them motivated, right? If you have someone that you go to classes with, or running groups, or fitness classes, or swimming, or yoga, or whatever it might be, and just to even check in with them, right? They might feel like, oh, I want to do it for myself, but if you have someone else just to hold them accountable, it could help motivate them. So at the end of the day, it's about motivation and mindset, and how to promote it in a positive way for each patient specifically. Do you find that was helpful with your patients when you sort of maybe even had them talk to other patients who might be doing similar things, or, like might have similar chronic conditions? If they see others doing things, maybe it might help them, motivate them to continue, right?
Absolutely. If we can somehow bypass that barrier of embarrassment and being shy and being a little bit not open to show their own weaknesses to others, once you pass that barrier, it actually becomes very strong to have patients linked together. Some of my very interesting days are Thursday mornings, because it's the busiest day of our clinic, and it's like there's a girls club party in the waiting room. All of these patients come from different parts of Ontario, and they meet there waiting for their appointments. And that they tell me that that's the most enjoyable time of their whole week, when they come and talk to other patients. This connecting with other people is in our DNA, is in our gene. And when patients connect to each other, it helps them to feel that this is not only them, it's not only their life sentence to deal with these challenges. There are other people that are dealing with these challenges as well. And then they can start to give each other courage. And as soon as they feel that they're helping somebody else in any way, they start to feel better and they feel empowered.
It gives them a sense of purpose too, right? To help
Exactly.
others. You feel good when you help others, right?
Yeah.
And so it's a great way to motivate.
It is. And listening to you, it's interesting that we started the discussion with all of these distinct pillars of health. And then as you go through the discussion related to the exercise, we notice that each of these pillars can be enhanced and improved by doing the exercise. And that gets me back to my point that I said that this is one unified life form experience of human life that we are talking about. And we make these distinction and separation synthetically, but in reality it's all connected, and the whole sum of whole person approach is what we need for our care.
Absolutely. Whole body wellness.
Exactly.
It's not only exercise, but it's also being connected with others, not being socially isolated. Managing depression, anxiety. How can you do that? Exercise is one, but eating a well-balanced diet, what does that entail? And it's individual too. Like a lot of the recommendations that are out there, they're guidelines, but there's some people might follow a different diet or a different exercise regime that works for them, but it gives them their optimal health. So personalized medicine is also another approach, and how to do that for each person is so important.
I always encourage my patients that if you keep doing these changes, if you make these changes and keep doing these practices and exercises, after a few months you will be a totally different person. And that totally different person is your real you that you have become.
Or it's your optimal you, right?
Yeah, exactly. The optimal you that will unlearn all of these ailments and limitations that you learn that you have, but that's not your true self. Thank you so much for the time and the discussion that you brought to the table today, and hopefully we can talk more about the other parts of this whole journey for healing.
Absolutely. So happy to be here. Thank you again.
Thank you.